Hello everyone, welcome to this practical pathology series from Pathology Made Simple at ilovepathology.com. The topic which I am covering today is squamous cell carcinoma. This is in continuation with the topic which I had discussed earlier, that is the pathogenesis of non-melanocytic skin cancers, before this video I had talked about basal cell carcinoma. So in this tutorial, I'll be discussing about the pre-malignant lesions of skin and then about the squamous cell carcinoma, its clinical features, morphology, and a bit about the prognosis. So before I talk about squamous cell carcinoma, let's see what are precancerous or pre-malignant lesions of skin. These are basically because of presence of dysplasia in the epidermal keratinocytes, which can involve the lower portion of the epidermis or the full thickness. Okay, so morphologically these are altered lesions which can progress to cancer, and that's the reason why they are called as precancerous or pre-malignant lesions. Now these are most often UV rays induced, like for example actinic keratosis and Bowen's disease are the most important pre-malignant lesions of the skin. So Bowen's disease is also referred to as squamous cell carcinoma in situ. So let us see the differences between actinic keratosis and Bowen's disease. So these basically clinically they are single or multiple. They are discrete, dry, they are rough, adherent, scaly lesions. They occur in habitually sun-exposed skin of adults. And whereas Bowen's disease basically is a sharply demarcated, which is scaly and erythematous plaque, which simulates a psoriatic lesion. Okay. So histologically these two are different. One which involves abnormal epidermal maturation and atypical keratinocytes involving the lower part of the epidermis. That's actinic keratosis. Whereas Bowen's disease, which is basically a squamous cell carcinoma in situ, you can find the entire thickness dysplasia. Okay, so that's when we call it as squamous cell carcinoma in situ, which has all the features of pleomorphism but does not show invasion. That's why it is in situ squamous cell carcinoma. Now moving on to squamous cell carcinoma, which is the second most common tumor arising on sun-exposed areas. In the last tutorial, we discussed about basal cell carcinoma, right? That is the most common skin tumor. Males are more commonly affected as compared to that of females. And as I have mentioned earlier, it's most common in the white skin individual because they are not protected from UV rays because of less amount of melanin. Of course, brown and black skinned individuals, even though they have melanin, they still can develop squamous cell carcinoma, but from causes other than UV radiation. Now, these tumor clinically they can be, they can look like a round nodule with central hyperkeratotic area, which can be firm and indolent. Or they can be, as I told you in the earlier tutorial, right? Lower lip lesions considered as squamous cell carcinoma. Upper lip lesions, think about basal cell carcinomas. So this is an example of a squamous cell carcinoma involving the lower lip. This is more of a nodulo-ulcerative lesion. Sometimes squamous cell carcinomas can be huge and they can be extensive, they can be proliferative cauliflower-like growth, and such lesions are usually found in the foot or the leg. So squamous cell carcinoma grossly, they are usually large exophytic nodulo-ulcerative growth involving the plantar aspect of the foot, and because it resembles that of a cauliflower, they are referred to as a cauliflower-like growth. So these are most often the verrucous type of squamous cell carcinomas. Okay, so squamous cell carcinomas of foot, they are usually having this type of morphology, that is cauliflower-like growth. So histologically, squamous cell carcinomas, they contain pleomorphic squamous epithelial cells. They are arising from the epidermis and then they extend deeper into the dermis. So you also find evidence of keratinization. Okay, this is the keratinization which is surrounded by concentric layers of keratin surrounded by abnormal squamous cells. So that is known as keratin pearl. So keratin pearl is one of the diagnostic features of squamous cell carcinoma, apart from finding these tumor cells which is extending from the epidermis into the dermis. On higher magnification, you can find that these tumor cells are large cells. They are polygonal with abundant eosinophilic cytoplasm. They have pleomorphic vesicular nuclei. So you find evidence of abnormal mitosis here and there. and that's the keratin pearl which we discussed earlier, right? So this is the higher magnification of squamous cell carcinoma. So this is an illustration of squamous cell carcinoma. You can find these abnormal cells. These are dyskeratotic cells, okay, which has dense eosinophilic cytoplasm and a pycnotic nuclei. These are dyskeratotic cells, okay, and you can find evidence of lymphocytic infiltration throughout the tumoral stroma. So let us understand this in the virtual slide. This slide is from pathpresenter.net. You can make out that this is an infiltrated tumor, right? So that's the surface epithelium. You can find these infiltrating tumor into the dermis. Can you make out these large polygonal tumor cells, clusters of tumor cells infiltrating into the dermis? So these are large cells, polygonal, abundant eosinophilic cytoplasm, and has a vesicular nuclei. Can you make out these beautiful squamous pearls, keratin pearls? So you can find concentric layers of keratin surrounded by these pleomorphic squamous epithelial cells. And that's one beautiful dyskeratotic cell. So you can make out that the amount of pleomorphism involving these squamous epithelial cells. So some amount of chronic inflammatory cell infiltrates in the stroma is what you are seeing here. So this is an invasive squamous cell carcinoma. So I'm just trying to show you the mitotic figures. Look at this. These are the abnormal mitotic figures in these tumor cells. Look at this. Some more mitotic figures. Pleomorphic cells, abundant cytoplasm, vesicular nuclei with prominent nucleoli. So that's about invasive squamous cell carcinoma, the microscopic findings. Usually these invasive squamous cell carcinomas are discovered when they are small and they are resectable if detected at that stage. So around 5% of squamous cell carcinomas, they do metastasize to the regional lymph nodes. So that's about squamous cell carcinoma. We discussed about the premalignant lesions of skin and in detail about the morphology of squamous cell carcinoma. Do hit a like button if you have liked this video. Do comment. Don't forget to subscribe and do share if you find this video useful. Thank you.